Hi everyone, have you heard of robotic cataract surgery? I am Dr. Srinivas K N, Senior Consultant, Shekar Eye Hospital, Nagar, Bengaluru. Today I am going to discuss about the robotic cataract surgery or blade-free cataract surgery, or also called as Femtosecond Laser cataract surgery. How does it work? Traditional phacoemulsification, the incisions are made with the blade, whereas in laser assisted cataract surgery, the corneal incisions are made through femtolaser. So the size of the incision is predetermined and it is entered into the computer before we proceed. Hence, the accuracy of doing the incision is very precise. So there is no errors in making the incisions. Before we do the cataract surgery, before we do the cataract removal, so there is an opening which has to be made in the capsule of the lens. The capsule is the one, it's a membrane, thin membrane which covers the whole lens. The front portion of the capsule is removed first. In traditional phacoemulsification, the capsule is opened with the help of bent needle. So the size you can't really consistently do the same size. Whereas in laser cataract surgery, the size of the opening is predetermined. You can fix the size of the capsule opening, either it is 5 mm or 6 mm or 5.2 mm, depending on the lens you use, the amount of cataract the patient has can be done. So the precision and the accuracy is very good in laser cataract surgery. So sizing of the capsular excess is important because when you place the lens, intraocular lens, inside the eye, the positioning is very accurate in these kind of capsular openings. Especially when we use premium lenses like multifocal lenses, EDOF lenses or toric lenses and all those things. Hence, the post-operative visual recovery is very good and very accurate. So once we remove the capsule, then we have to remove the cataract. So before we remove the cataract has to be made into smaller fragments. It has to cut into pieces. In traditional phacoemulsification, the fragments are made with the help of phaco energy or ultrasound energy. Here, since you are doing with ultrasound, so the energy is used more. Whereas in laser cataract surgery, we can divide these nucleus into multiple pieces with the help of femtolaser. Here again, the number of pieces, the size of the pieces can be predetermined. So once we do the fragmentation of the nucleus or the cataract, then we'll have to suck it with the help of phaco energy or ultrasound energy. So here when we do aspiration of these pieces, the energy, ultrasound energy used very less. So hence the tissue damage, surrounding tissue damage is very minimal. So once we remove the cataract or nucleus, then we do the cortical wash and then place the small foldable intraocular lens into the eye. As you know, every step in cataract surgery is done through laser. It is more precise, more accurate. So please opt for laser cataract surgery in your future consultations. If you want to know more about these procedures, please visit our hospital, Shekar Eye Hospital in Nagar, Bengaluru. Thank you.